This is Brian.
Sarah.
And we are Khaki Shorts, and we are back home safe and sound in Atlanta, Georgia after our trip to Japan and South Korea. And we are going to kind of give you a rundown of our last flight back and how things were at Incheon Airport in South Korea and also the Atlanta airport when we got back. So stay with us.
This is Khaki Shorts, where we cover travel, food, and just utter nonsense.
Our last video we talked about, we were actually in our hotel room in South Korea at the Grand Hyatt. We were like kind of just isolating ourselves for our 20 hours we were in South Korea because
we had a layover for our flight, and we flew into South Korea around 1 p.m. and we stayed until the next morning, since our flight back to Atlanta was at 9:45 in the morning.
Yeah, and we were staying at the Grand Hyatt. We literally went from the airport, took a shuttle bus to the hotel, stayed in our hotel room, 8-room service, didn't leave until the next morning, took the shuttle bus right back to the airports. We literally didn't come into contact with anybody in South Korea except for the staff of the hotel and the airport people. Everybody at the airport, everybody, the shuttle bus driver, the hotel, they all had masks on. When we got off the flight, they were doing the FLIR cameras to check for fevers. They didn't do like, you know, hold it up per person, but they just
scanned everybody coming in through the gates. I guess you're kind of getting funneled into immigration and customs, and so before that they were just kind of had cameras on everyone just to
make sure anybody didn't have a high fever. And then we took the shuttle bus to our hotel, and they actually were only letting people in through the main entrance, the main lobby, and they had a camera there and a guy staffing it who was checking every guest that came through. So they were taking it very seriously there. So the next morning we got up. This was after our video we filmed then. We took the 6:30 a.m. shuttle bus back to the airport. Went through customs security, no problem. It was not, I mean, completely dead. There were a lot more people on this flight. We were on
I was thinking maybe there would be an empty plane, or it would be like a lot less people flying to Atlanta from South Korea because of the travel restrictions. There aren't any travel restrictions. It's just that level 3, and then the US is just giving warnings, but there are no travel restrictions. And so that flight was full.
It was full. It was probably 95% full. We saw a few empty seats, but not many. And I know that some of the other airlines, like maybe Delta and some of the others that fly from South Korea, had canceled some of their flights. I think they canceled all their flights.
Not sure, but then there was someone that was arguing with one of those customer service reps about, I had a first class ticket on Delta, and now you guys have me in economy, and they were telling him that's the only ticket they have. And I didn't listen to the whole conversation, but I was kind of suspecting that maybe Delta canceled their flights and pushed a lot of their passengers onto their partner airline.
And he was going to have to go back with Delta to get reimbursed or whatever, but I think he was probably just happy he had a seat.
I just noticed that a lot of the passengers that were on our flight from Seoul to Atlanta were Vietnamese. There were a lot of Vietnamese passengers. There are some Korean passengers, but it was just like, wow, it's an overwhelming amount of maybe they had to transfer in Korea, I don't know. Right,
I think they bought a Korean air ticket in, you know, Ho Chi Minh City, and they had to transfer through Seoul just like the rest of us, so they were kind of in the same boat. The flight, we heard some coughing and sneezing, but just the normal amount for a flight. I mean, it wasn't.
But now everyone's a little like, oh my God, did you hear that sneeze?
Yeah, as soon as you hear a sneeze, you turn around, who's coughing?
Everyone had masks on the flight. The attendants had masks. All the passengers, maybe like a handful of non-Asian people didn't have masks.
Right.
I think.
We wore ours kind of on and off. It's a long flight. It's like a 13-hour flight. It's hard to wear a mask full time for 13 hours. So, but as soon as we got on the plane, we had these wet wipes. I mean, not just wet wipes. These are like bleach wipes. And we wiped down the seats, or the armchairs of the seats, the remote, the screen, everything we would be touching, the shades. Yeah, we wiped down all that really good. So nobody else would really be touching that except for us. So once we got it all cleaned, and then we had a hand sanitizer thing we actually kept in the pocket of the one in front of us. So if we went to the bathroom or something, we'd wash our hands good, but we would come back and do hand sanitizer again. Before we ate, we'd use it good. So we were trying to be really careful on the flight.
But if you kind of think about it though, you know, you have to take your mask off to eat. You have to take your mask off to drink. And when you're doing that, you're breathing.
Right. So
I don't know how effective
Yeah.
it is.
So we got back to Atlanta. Actually, before we got on the plane to South Korea, when they saw that we were U.S. citizens, since South Korea was at a level 4, they had to scan us, or what do they call it?
But basically, the screening process
Screening.
for us,
Yeah, they were screening everyone.
the screening process was at the gate before you board the plane. They ask you, have you been to China in the last 14 days? They didn't even ask us about how long we've been in Korea.
Mm-mm.
They just said, have you been in China in the last 14 days? We're like, nope. And
No.
then they ask you about your luggage. You know, did anyone pack
Yeah.
for you? Are you bringing anything that's not allowed? No, no, no. All right. And then you get in, and then right before you enter the walkway into the plane, there's another guy with a camera scanning the heat scan
For fevers,
sensor.
yeah.
And that was it. That was our scanning.
Right. So when we got back to Atlanta, we got off the plane, came through customs, came through immigration.
I didn't see any cameras set
I
up
didn't
to
see
scan
any.
us at Atlanta when we landed, which is weird because I thought they'd be all in arms, and I was
Yeah.
prepared to have to talk to someone and tell them we hadn't been to China, we'd only been in Korea for one
We
night.
didn't have any
We were in
symptoms.
Japan for 13 days. Yeah, I thought, and they'd give you instructions, but there's no one at the gate or at the immigration or customs area to do anything about that. And then you go through the automated immigration saying how many stuff you've brought in, scan your passport, and then did the immigration officer ask us where we've been?
No, he don't think so. He looked at our passports and scanned them, which I guess from the scan he could tell we had been to Korea, but that was it. He's like, you know, have we come into contact with any livestock or anything? But other than that, he's like, okay, here you go,
Yeah,
you're
so
done.
unless they were scanning us from some remote location where
Or
we
had the
couldn't
camera
see
hidden
the
where we couldn't
camera,
see
right.
it or didn't notice it. All the other cameras we saw had somebody standing behind it, and they were keeping an eye on it. So unless at Atlanta they have them, and they have somebody in another room where you can't see them, and they're...
And I didn't see any camera set up
Mm-mm.
shooting at the passengers
No.
coming through. I don't know if we were like screened.
Right.
And then now I've read somewhere that what they mean by screening is they give the airport that you're coming from the questions and you get screened there. But I didn't see any active screening or instructions given once
No.
you land. And honestly, what's for me to say, you know, when we boarded the Korean airline flight and we'd actually been to China, I mean, I could still say
I could say no.
Like, it's not an officer that's asking me that, it's an airport employee.
Right.
So, like, I could say no and not get into any trouble, I think. Thought
That's-
it would be a lot more serious, but didn't really seem like
And-
anything out of the norm.
And we saw some stories where people were complaining about, I guess now in Atlanta at the airport, they had like 200 passengers come through that have all shown symptoms, I guess maybe a fever or coughing, and I think they told a lot of them, just isolate yourself at home. That's all they're really telling them to do. So, which is actually what we're doing right now, because before we left Korea, we got in touch with my employer and hers, and just kind of let them know we were coming through South Korea. We were only going to be there for 20 hours. We weren't sick. We weren't showing any symptoms. We felt fine, but we wanted to give them a heads up. That's where we were coming from, since it was kind of on their watch list. And both of our employers decided to not let us come to work for 2 weeks. Luckily, we have a second house near my job, just because I had to commute so far. So we are actually kind of isolating ourselves here. We're the only two here. Our other house, all 4 of our kids,
Right.
well, 3 of our kids are there. One's off of college, but the other 3 are there. The oldest would have had to, if we had gone home and been exposed to us, then the oldest would have had to work from home for 14 days.
Right.
The youngest one would have had to done
Pull
her
out of
schoolwork
school.
from home.
Online classes.
Right, and then my son, who's 23, he is working for a physical therapist, so he's in contact with a bunch of patients every day.
I'm sure
So
he would have had
he would have had to have not
stop
worked, right? So
school for
we would have just, even though we're not sick, we would have, just because of the policies, we would have affected a
The
lot of
whole
people at
house.
home. And plus, her mom is 84
84
years old, and we didn't want to have any chance of, if we were asymptomatic and were sick, to give anything to her. We decided to stay here. We're here for 2 weeks. It's going to be kind of boring.
What we're gonna do?
I don't know, because we're going to be
Technically,
bored.
we're not on lockdown,
Right.
according to CDC.
We're not quarantined.
We're not quarantined in house because we have no symptoms, and we're just supposed to self-monitor. But our employers, their policy is just a little above and beyond CDC, which is fine. I mean, I understand.
Yeah.
I wouldn't want my coworker to come back and maybe bring me something special that I don't want. But
A little special gift.
we're not technically quarantined. But on the other hand, we don't want to go out all the time and
Right.
maybe eventually get sick and say like, oh, now we have to tell you, here's a long list of places we've been.
Right.
Right, so I don't want to do that.
So we actually brought gifts back, and we've had someone just like, we drop the gifts off, or they come and pick them up real quick and take them where they need to go, so that we're not visiting relatives. And
yeah, we're not even visiting.
We're not even visiting. We haven't seen our kids. We haven't seen our mom. We have my mother picked us up from the airport, but before we went out, we washed our hands good. We hand sanitized.
We actually had masks.
We were both wearing masks in the car. Yeah, and she didn't even come in the house when we got home. We handled our own luggage. Nobody else touched it.
Now it feels weird not wearing a mask.
Yeah, it does feel a little weird when you go, if you're going to go out. It would just be like, you're so used to putting it on.
You actually put a mask on. I don't know.
And I know that the Surgeon General is like, don't wear a mask. It's stupid. In the U.S., where it's like there's a little more room and you're not right up next to people, and plus they need them for health care people, I think they're running low. And a lot of it, people are just hoarding them. They're buying up tons of them. Luckily, we took some with us, and in Japan, especially when you're riding the subway, it's so tight. I mean, you're literally like up next to somebody sometimes, like crunched in here. So you're breathing. I mean, or if somebody sneezed or coughed, literally they could get something on us. So that's good to have, just to cover your nose and your mouth.
Or if you sneeze, and then now, like, you know how like a sneeze comes on and you're like, achoo, oh, sorry about that.
Right in somebody's face.
So I'm sure
I,
they wouldn't appreciate that.
I think that's why more in Asia, that people don't understand why people wear them more over there. It's just because it's such a tight community in a lot of these big cities. So that's kind of why.
Unless you're like in New York and you're on the subways like that too. I mean, I'd be concerned if I was riding the subways and it was so crowded, enclosed space.
People just right next to you, breathing
here,
on you.
I'm driving my own car.
Right.
I'm not a Lyft driver. I'd be concerned if I was a Lyft driver. You know, who knows? Or a taxi
yeah, because you don't know
driver.
who you're picking up, like Lyft or Uber.
And you know, a lot of those cases now are people that haven't even been overseas. They were like, oh, I was in Washington, or I visited Miami and came back, and now I have the coronavirus.
Right. So it's not like you can say, oh, you've been to China, you're a risk. Now it's people from anywhere. So it's going to be curious to see how things kind of develop in the U.S. over the next couple of weeks. I guess we'll just be sitting here watching it on TV because we're not going out anywhere.
I don't know what we're gonna do for 2 weeks.
Yeah, we're gonna catch up on our Netflix and our Disney Plus, I guess.
So I guess the gist of it is, if you still need, if you have plans to go, and you don't want to like break those plans, I know it's a pain in the butt because we planned our Japan trip. So the Japan trip occurred mid-February, but we planned it since September.
Right.
So we had paid for everything. Everything was, set up, and it's not like you can just cancel.
Right. And the first case of coronavirus didn't come up until December, and that was all in like Wuhan, China. So like Japan wasn't even affected at that point. And when we left, Japan only had a couple.
It's level 2. It's not even 3.
Right. It was still a level 1. They only had a few cases.
And then it became 2 by the time we left.
And we were on the plane to fly to Seoul, South Korea for our transfer, and we heard about President Trump's press conference where they raised South Korea to a 4. So I mean, it's like we couldn't even get off the plane at that point. They closed the door and we were taxiing.
Right.
So we were kind of stuck to go there. And people have been, well, why are you traveling at all? It's like, well, when we left, it wasn't like this.
It was a fluid situation. I mean, it's ongoing. So it's not like you can just, anyone that's been overseas, you can't just pick up and be like, you know what, even though my flight's next Friday, I'm going to pick up and leave this afternoon, because one, you cannot change your ticket without a change fee. And it's pretty prohibitive, especially if you have cheap tickets.
Right.
And 2, if you fly that afternoon or whatever on standby flights, that would cost thousands of dollars.
Big money.
And then now you've lost your hotel money because it's non-cancelable at this point. Now you're out a few thousands of dollars. I don't know if it's worth it,
Right.
So
as of right now, knowing how the situation is in those countries, if you're close to your trip, I mean, a lot of the tourist sites are closed. I mean, just in Japan, a lot of the museums are closing.
Events.
Disney had closed most of their things. They're canceling the Cherry Blossom Festival, where gatherings come. I mean, it's just a lot of stuff's getting canceled. So if you're doing the tourist stuff, a lot of the stuff you would have done is closing. I think the shrines might be next where they start.
I don't know, or make alternate plans.
Yeah.
And then realize when you get back, depending on where you transit, or maybe you're in Japan when it gets raised to a 3. Now you're back, and now you're like, I'm stuck now. I can't go back to work. So,
you can't go back to work. You might affect your kids or other people in your household that they might not be able to go back to school or to work. But we're home. We're safe. We're not showing any symptoms yet. We're
All of us have been home for like a day.
Yeah, we've only been home for a day, but I
Ish.
mean, you know, other than a little jet lag, we're feeling good. We're just trying to get our days flipped back.
Well, I have plenty of time to catch up.
Yeah, I got plenty of time to catch up on that and
Yeah.
take some naps. So, all right, thanks for watching, and we might put out another one if anything changes. But as of right now, we're home and feeling good. So,
Knock on wood.
yeah, knock on wood. Thanks for watching.